I just
Well,
saw, yeah.
I believe, okay, we are now, there we are on Clubhouse. Okay, so TJ, I'm going to ask you to mute yourself on Clubhouse.
Okay. Better?
Okay. Yes. And then they can hear me through Clubhouse. That's good. And then here we are live on Facebook. I feel so like funny that I'm doing all this complicated technology. We're going to share it also to my personal Facebook live. Awesome. Yay. I think we've got it. Welcome, everybody. I'm Dr. Adriana Popescu. I am a licensed clinical psychologist. I am an addiction and trauma specialist, and I'm also an empowerment coach. And I'm so excited to be here today with one of my favorite people, TJ Woodward, who is himself a recovery expert, specialist, I believe, and an inspirational speaker. And he is the amazing creator of a wonderful approach to addiction and recovery called conscious recovery. So welcome, TJ.
Thank you, Adriana. So happy to be here. I have to just admit, this is my very first Clubhouse moment. So we're going to see what happens. And I'm really grateful. I always love being in conversation with you. And I know this is going to be fun.
I know. So, I think what we'll do is we'll ping. I'm going to see here. I see that we have ways to do this where we can ping people in Clubhouse to let them know that we're on. And can you explain while I'm doing that, since I suck at multitasking, can you explain? Okay. Yeah, keep yourself muted on Clubhouse, I think.
Right.
But can you explain to people what Clubhouse even is?
No, I cannot. I mean, I would love to, but I have never been on it. My friend Tim invited me and I said yes. And I know that it's a place where people can, I'm thinking like if you're old enough to remember chat rooms, right? The AOL chat rooms, these are like actual live chat rooms where you go into a room and have a conversation. And Adriana, I think you've experimented with this more than I have. And I love the conversation about is addiction a disease? Is it really a disease? So hopefully people will join us on Clubhouse and on Facebook while we have this conversation.
Yes, exactly. And if not, they'll watch it later. But yes, Clubhouse is like basically, see, we do have somebody here. We have Adele. Hi, Adele. We actually do have, Clubhouse is this new platform that's really, it's all audio and it's like spontaneous conversations that people are having. And so I just thought it would be, since we're so used to being on Facebook and doing Facebook Lives, I thought, okay, let's try to do both and just see if because Clubhouse is still so new, but we do have somebody in the Clubhouse with us, which is cool. So hi, Saf, welcome for Saf. I don't know how
it's my friend Saf from the UK. So he's joining us from the UK right now.
Excellent. Well, welcome. And feel free if you have any questions or anything. On Clubhouse, it's easy for people to just speak up. I think I can make them speakers. And also, if you're on Facebook with us, you can type comments in the comment box, and we're kind of watching both. So, all right, TJ, let's get into it. Is addiction really a disease? What do you say?
Well, okay. So I was reflecting on this today, and Adriana, you've known me long enough to know I'm not going to actually give a firm answer, and I'm going to tell you why. Because it's curious to me what is a disease? Even that concept of a disease, right? In my experience, I think there are multiple different things that can cause addiction, including the possibility that it is a disease. But my question, and I know you and I, Adriana, love being in the question. My question is, what gets created when we are told, or when we tell our clients, or if you're a person in recovery, or you're a person who has had an addiction, what gets created when we say you have a chronic illness that can never be healed, but only treated? That's the curiosity that I have around it. Not, I want to debate whether or not it's a disease. I really love the question, what gets created when? Adriana, you and I use this question a lot.
Yeah. Well, it goes to the idea that your point of view creates your reality, right? Like if you have the point of view that I have an incurable disease that will only get worse, and that the only way, the best I can do is just somehow find a way to manage it. I think yeah, what does that create? That can create a very, I don't know, pessimistic, fatalistic point of view that, reinforces the idea I'm broken and there's something wrong with me. I'm not enough. I'm not like other people. It really perpetrates, I think, a very negative mindset.
Yeah, and it's interesting because if you look historically at where this started, it really started in 1935 when AA came into the scene and really did say addiction, or in this case, alcoholism, is a disease. And I think it came from what happened before that, which was it was looked at it as a moral deficiency, right? It was looked at as something's wrong with this person from a moral standpoint. And so AA came along and said it's actually a disease. And I think there was a lot of relief for people. Oh, this isn't that I am wrong or bad. This is that I am sick. And that I think was an important part of the evolution. And now I feel like we're at the precipice, or really we're in the midst of a profound shift in the way we're viewing even anything else we call a disease, much less addiction or alcoholism. I do think in the beginning for me, and I'm going to speak just for myself, when I remember being 7 days sober, I really remember sitting on my couch, breaking down, crying, and thinking, oh my gosh, I'm not a damaged person. I have this illness. So in the beginning, it was actually really even useful for me, and it was a huge relief. Then as I stayed sober, I started to ask myself the question, wow, why do I keep calling myself this? Why do I, no one would say, my name is TJ and I am cancer, right? You wouldn't own that, right? And so in that same way, why would we keep affirming that we have this chronic lifelong illness?
Right. I mean, brilliant. Yeah. Why would we? Exactly. And I guess too, like when I look at the word disease, what do we even mean when we say disease, right? Like I question even like the definition of the word, because what I like about it, the way I look at that term, is dis-ease, right? It's a state of not having ease. And when you're in the throes of an addiction, you're not at ease. You're not okay with yourself. You might be dealing with toxic shame. That's something you and I talk about a lot.
Yeah.
The pain and discomfort of toxic shame, of these core false beliefs, believing you're a bad person, that you deserve to suffer, you don't deserve to be happy. All of those things would create a state of dis-ease, and you might go seeking for a substance, a behavior, a something to like try to make yourself feel better from all that lack of ease.
That's right. And, in conscious recovery, we call addiction a brilliant strategy. We could also use that with all sorts of other diagnoses. In your podcast, you talk about different approaches to mental health and well being. And we can take this even more broadly and not just look at addiction, but all the different mental health diagnoses, what some would call mental illness. And of course, I would never use that word, but even those diagnoses, like you and I have worked in the field of mental health and addiction for so long, we have heard people being referred to as their diagnosis, like it's who they are rather than what they have. And I think the intention, at least at the core of it, is really well-meaning. People are getting diagnosed so that we can offer ways to treat them and help them get better. I think that the shadow side of it, though, is people start to get viewed as their diagnosis. And then sometimes they get told that it's biological or chemical, organic in some way. And the truth is, we don't really know 100% if it is. And even if it is, we now know that we can change the brain. We can even change our DNA through our healing. So even if we say it is a disease, I'm going to at least say, what if it's not chronic and lifelong? What if, as you said, if it's a dis-ease and we look at the addiction itself as a strategy, not the problem, then it opens up a lot of different possibilities for healing.
Yep. Yep. One of the things that I love to talk about with clients, is an idea that I actually got from a colleague of mine named Marilyn Bradford, who wrote this really cool book called Right Recovery for You. And in it, she talks about how the primary addiction is not to the substances or sex or gambling or whatever the problem behavior is. The primary addiction is actually the self-judgment.
Oh,
And then if
wow.
we were not to be judging ourselves so much all the time and so harshly, we wouldn't have that dis-ease, right? That we're needing to seek for the soothing and the comfort and use that brilliant strategy to try to feel better about ourselves when, we're in this constant state of like negative self-talk, essentially.
Yeah, and that's really at the core of, I know, my work and your work, Adriana. We really recognize that when you take away whatever we might label as an addiction, you listed several, the list could go on, right? I think in our culture, another thing we're addicted to is drama, right? The news now is just so in your face 24 hours a day of fear, 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 right? And so when we take away whatever that substance is, like, someone might be addicted to reality TV. Imagine turning it off and not watching it for a year and then see what comes up, right? So the underlying issues, as we have talked about so many times, one of them is shame, and it is connected with these core false beliefs, this inner narrative. But you and I know that it's even deeper than that. It's really an energy or a frequency. And we create our reality not just based on our thoughts, because that is part of how we create reality, but the energy field underneath those thoughts, the narrative. I wasn't aware of my inner dialogue for many, many years. And then when I became aware of it, I went into even more blame and shame. I can't believe I'm doing this to myself. But that was all an energy, right? I believed so deeply that I was unworthy. And it was more than just a thought. It was really, I mean, I even, as I'm saying it, my body's closing, and that's how I used to walk around, just feeling really closed and broken and damaged.
Yeah, it really is. And that's what I was thinking earlier too when we started talking is like fundamentally to me as an energy psychologist, because there's actually a specialty within psychology in the last 30 years that's really devoted to looking at things holistically and just like in conscious recovery, really exploring something like addiction or depression from the physical, mental, emotional, and spiritual perspectives. Um, but underneath it all, the common denominator is energy. Your thoughts are energy. Your biology is an energy. Your emotions are energy. You, the being, your spirit is an energy, right? It's a unique vibration. And so, energy, if you can remember back to your high school, chemistry and physics classes and stuff, energy is always in motion, right? And so it's always, the electrons and protons that are moving around and vibrating and doing all these things. So nothing is ever fixed. Nothing is ever actually permanent or stuck. All energy eventually changes. The chairs we're sitting in eventually will decompose and change forms, right? Our bodies will cease to exist as we know them now, right? So that's the encouraging thing to me, again, like, and why maybe this idea of a permanent condition you have is not really true, because if the energy can be changed, we can change our genetics. The whole field of epigenetics is showing us that if we can change our thoughts and our feelings, what else is possible? But there is some part of us that we don't change. And I want you to talk about that. Is that part of us that's unharmed and unharmable?
Well, yeah, but I first I have to comment on what you're saying, because it's really exciting for someone to really understand that, and not just as an intellectual concept, but as a practice, right? Because really this is an experience. If it's true that we are energy, and if it's true see, the thing is, our energy field is actually always present. And as you're saying, it is it's always there. But what keeps it stuck is our own ideas, our own beliefs. I'm thinking about like the narrative that gets passed down based on age. That's a big one. Like I look at people that are my chronological age and they have all these stories about what that means. And I see them manifesting that in their life, right? And it's because there's a belief that's been passed down. Isn't it interesting that humans are living longer and longer? Now, we can say that medical advancements have helped with that, which absolutely is true, but it's also a belief. It's also an energy, a frequency. You know, when people say things like 50 is the new 30 and 60 is the new 40, when we really understand that, we do actually change our bodies. This has been proven. Now, the underlying unharmable piece is also such a huge conversation, right? And this is a spiritual truth that has been around for thousands of years, that there is a place within us, an essential place that is unharmed and unharmable. And when we tap into that, in my experience, we tap into this infinite amount of energy, right? This energy that's not then um, in some way restricted, right? Because if you look at form is just compressed energy. Like you talked about the chair, we experience it as solid, but we really understand now that it's not solid. It's whirling energy, right? And so when we tap into that place within ourselves that is unharmed and unharmable, we could also we could refer to that as unharmed energy. Now, I'm not saying you can really harm the energy, but you can actually restrict it, right? I think about it in simple ways like a garden hose. You know, remember, if you're old enough to remember drinking out of the garden hose, you would kink the hose and water wouldn't come out. And then you would open the hose and the water would flow, right? The water's always there, but it's the restriction of that flow of energy. And of course, this is Eastern medicine as well, that looks at the energy centers and how we block that chi or block that flow. And the same is so true with addiction. And it breaks my heart, honestly, when I hear someone say, you know, I'm 30 years sober, but I'm just a effed up alcoholic. So I don't know how to live life. My thinking is messed up. I'm bodily and mentally different than the people around me. There's something fundamentally wrong with me. We know that that's kinking that hose. That's literally like every single story and the energy that goes with it is blocking the flow of this infinite and abundant energy that is our true source.
Well, and the thing is too, I'm right with you. And we're not born with that. All that judgment is learned, right? It's not something that when you look at children, and I think it's such a great example because a lot of the clients I work with at the rehab where I work are women and their mothers. And you know, I'm like, you look at your own child. Do you look at your child and say, this child is defective? There's something wrong with him. You know, like you would never do that. And you can see so clearly that essence you're talking about, that pure, the water flowing, the light shining bright, the joy, the happiness, you know, that children are. And we always all have that within us. We just have gotten cut off, right, from that awareness. Our hose got kinked somehow, whether it was through trauma, whether it was through you know, negative beliefs we picked up from other people or whatever it is. But like, it's not really the truth of who and what we are. We're not a defective kinked hose.
Yeah, and when you're speaking, I'm thinking and going back to the idea that it's what we have and not who we are, right? So I can have a collection of beliefs about myself and the world, and we can question those beliefs and start to change them. And there's this other place where we can say, wow, what gets created when I realize I have a story, but I'm not my story, right? When we say we're a sum total of our experiences, no, that's not actually accurate. I'm a sum total of the way I have framed my story. I remember when I first got into recovery, I called my sisters and I was asking them about our childhoods and I was asking them to tell their version of the story. And lo and behold, they didn't have different versions of the story. They had totally different stories. I had a story, dad was never home, and therefore I decided I was unlovable. My younger sister is like, oh my gosh, dad was there every night for dinner. I'm like, what family did you live in? Right? So we don't even know what actually happened, but it's what I'm holding about what happened that creates what I actually experience as reality. And the healing is to get back to, you know, the 6-year-old, the 7-year-old, the 8-year-old, because just like you said, if it's true, and in my experience it is, that we come in with this natural flow of whether we use the analogy of water or light, and then all this stuff that happens gets piled on top of it. It's really about dismantling that and returning to that pure essence. And then from there, we have this infinite energy.
Yes, exactly. And so let's go with that. What does that then mean? What are the implications of that for recovery? You and I both have worked in the treatment field with the sort of standard, treatment paradigm of addiction treatment. What does that mean then? How do we work with people differently to help restore that connection to that unharmed and unharmable self?
Well, you and I also know that very little of the way we communicate is verbal. So it's really not what I say to a client. It's not that I'm teaching them anything. You and I go to so many addiction conferences, and the experts stand up on the stage, and they tend to teach concepts, teach thoughts, teach frameworks, which is great, except for it's only in the mind. And that's only a small percentage of the way we actually change and heal. And so the first thing I would say is that the number one thing I can do to help anyone who is a client is to do my own healing. And as I do my own healing, I see myself as a whole and perfect being, and then I can see them as that. And there's an interesting paradox, because sometimes people will say to me, like, do I really think all it is about having someone realize they're a whole and perfect being? Yes, I think it can be that, but it also can be a process, right? Because there are layers of these beliefs, and many of them, my favorite word, are concretized so deeply in the unconscious that they're not even aware of it. So a simple answer to your question is, the number one thing I can do for clients is view them as having everything within them to heal, and recognizing that there's a place within them that doesn't even need to heal. It's already whole. And then the journey becomes witnessing together our ability to look at all the different ways that we have blocked that natural light. Then it becomes about unlearning, not about learning.
I think what you're saying is so important. I wish I had a big highlighter and we could just like, really highlight that, because so many of us practitioners, especially trained on the mental health side, are taught to diagnose and pathologize, and people really do look at clients through that label. Oh, this client's borderline, this client has, PTSD. And how much does that then, again, with the nonverbal communication and energy, if someone is seeing you with this pathology, right? How isn't that going to just reinforce the person's negative core beliefs? They already feel bad and broken and defective. Well, now I have this label on top of it. I think what you're talking about, when we're functioning from our own essential wholeness, and
Yes.
we're in that space of I feel good about my authentic self, then we can be present with someone else's authentic self, even if they can't see it. If I can see the light inside of them, and I can support that light and nurture it, and like you would a plant, water it and feed it and all that and help it to grow, that's really the healing.
Yeah. And I'm reflecting about how many times I've sat down with a client and not even there were no words exchanged, and they would break down crying. And the reason that I think, in my experience, the reason those tears came up is it wasn't what I was saying, it was how I was beholding them. And I use that term very consciously. I'm looking at them as whole and perfect. I remember when I started working in the field, I came in with a background of spirituality. I came in with a background of spiritual leadership, spiritual counseling, and also my own journey of recovery. And I quickly realized I didn't want to read someone's chart before I met with them. And that's really common in our field. Let's look at they're at treatment for the fifth time. So let's look back at what the last treatment center said as a basic groundwork to how we can help this client. I think that has a place. I want to be clear. I'm not saying that that's wrong. What I'm offering and what we offer is, in addition to that, let's look at what happens when we don't view them as their diagnosis, because the diagnosis is only symptoms. That's how they're getting the diagnosis. Now, I know that science is evolving and we're looking at a lot of different things. So, but no one comes in and says, let's take your blood so we can see if you have borderline personality disorder. What we're
Right.
doing, and we could even talk about that, we could even change that. But for this, it's just a cluster of symptoms, right? So if we stop looking at the symptoms as who they are, and we start looking at the diagnosis as a strategy they've been using to try to heal, then something totally different gets created.
Yes, exactly. And what if that could be the emerging treatment paradigm, right?
Yes, and I'm really happy that you said this because you and I know that we're going to be doing a conference in October. I actually just signed the contract with the hotel, so we can it's a sneak peek. It's a quick announcement that we are going to be doing a conference called the Emergence Conference twice a year that is hosted by Conscious Recovery. And we are looking at what is emerging in the field of addiction and mental health. And this first conference on October 15th, you're going to speak, I'm going to speak. And the focus of this particular conference is the emerging new treatment modalities, including conscious recovery and including energy psychology, which of course is what you and I are both going to talk about. And at this conference, we're not going to be doing PowerPoints. We're not going to be doing that. We're going to be really expressing a new way to look at, to treat, and to heal addiction and mental health.
Yes, exactly. And the feedback, we share a little bit about the feedback that we've gotten. When you and I last spoke, I think it was at Dr. Smith's symposium, and there were people walking up to me. I don't usually get this. Maybe you've gotten this before. You're a little bit more of a public figure than I am, but I had people coming up to me saying, you don't know me, but conscious recovery is just, it's changed my life. And I'm just so grateful for the work that you do. Thank you. And it was just so moving, to hear that from people that I don't even know. Like, this work really is profound. It's really speaking to people.
Yeah, I called a treatment program yesterday and someone said, "Oh, is this TJ? I just want to let you know how much you've helped our clients." And I spoke yesterday on a Facebook Live to a group of mothers, to this wonderful group, and so many of them were resonating so deeply because so many people are viewed as broken, right? And so many times, if we think about the client that's been in treatment for the fifth time, right, and they come back, and then we say, "What are you going to do differently?" And that's a valid question. And what are we going to do differently? And that's what you and I are up to. We're up to offering some different perspectives, not to negate the other ones, because I think that's so interesting, the human mind. It's either this or it's that. And we're saying it's this and that. So yeah, let's do all of that. Let's look at the physical, intellectual, emotional, and spiritual. And we're on the precipice of this great new paradigm. And the new paradigm really is the wholeness paradigm, the recognition that there's a place within everyone that is always whole and perfect. And therefore, when we tap into that, it starts to heal those other parts of ourselves. This, we could call it revolutionary, but it's also ancient. It's really ancient to recognize this.
Yeah, totally. Oh, TJ, we could just go on and on. This is
We could.
it's always so fun to talk with you. And I love that, we're putting this out there in the world. And even like, the fascinating thing to me is, like, even if nobody's hearing, no one's in the clubhouse right now, but like, what is just you and I speaking these energies and putting them out in the world? Like, what if that in and of itself is changing things?
That's right. Well, because it's all consciousness. And when we think about how meditation changes crime rates, that's been measured. When we think about new ideas that are born within someone's consciousness and then we pick it up, right? Like, I'm thinking about my friend Michael Beckwith. When I did my very, very first talk, I had this whole framework that I created, and I'm using air quotes if you can't see it, about these 4 levels of consciousness. And then a friend of mine walked up to me and said, "Wow, that sounds just like what Michael Beckwith is saying." And I hadn't ever read his book. And then lo and behold, it's almost the exact same framework. And then someone else said, oh my gosh, that's also really similar to this other person that was around 50 years ago writing about this. And so we pick these things up, and then it has an impact, it has an effect on consciousness as a whole. And when you and I met over 10 years ago, Adriana, we were a little bit in the closet with some of this when we did our work. There were very few, we weren't sitting around the table at our treatment program at dinner talking about energy and frequency, and there's a place within everyone that's whole and perfect. I had a select few people that I was talking with about that. And I've had therapists come up to me time and time again and say, thank you for finally bringing to the forefront what we've kind of been secretly doing all along.
Yeah, exactly. And my greatest hope for the future and why I'm out there just, speaking to as many people as I can about it and making videos like this and going on new platforms and seeing what we can create is because I think that's it. It's like we're finally, it's time. The time has come for this knowledge, this consciousness to be in the world, for people to know that there are other ways to see things, including addiction, mental health, recovery, and that there are places people can go and communities they can be part of where rather than a bunch of broken people getting together to talk about how fucked up they are, maybe it's about people gathering together to acknowledge what's great about ourselves and each other and what can we all create together. That's
Yeah,
really
for
my hope, my vision.
yeah, I love it. I love it. And I'm with you. And I, even from a pure change perspective, we don't change habits on what we don't want. We change habits based on what we do want, right? So when I hear people say, I never want to forget how bad my addiction was, I'm like, well, okay. And so it is, right? Then I'm living in that. I'm not saying that we want to pretend like that didn't happen. I'm not saying we don't need to clean up, you know, things that we've done in the past. I'm not saying we don't need to have accountability, but that has a very short shelf life, right? And so when clients are in treatment and they're talking about fighting addiction and how horrible it was and that they've got this and they're going to beat it down, that has a short shelf life. And I think it can be useful for, a day, a week, maybe even a month. But at some point, in order for us to really heal, it's about what we want to move toward. And I love what you're saying, because bringing a group of people together to affirm that wholeness is really different than a group of people coming together to talk about the brokenness.
Yeah. Well, on that note, thank you so much for meeting with me today and having this amazing conversation. If people want to find out more about you, about conscious recovery, where should they go?
Consciousrecovery.com is the easiest place to find so much exciting information.
Yep. And we're going to go ahead and add that to the comment box and my website. And if you want to find out more about what I'm up to is adrianapopescu.org. And if you guys like, what we're talking about, please click like, share this, video with people, invite other people on the Clubhouse, as we get to know this platform a little bit better, we'll have more conversations, invite other people to join us there. I have a podcast, and I think are you still doing some podcast work too?
I've been focusing on being a guest on podcasts rather than having a podcast, but sometimes we think we want to launch an unharmable podcast. At this point, I actually had this week is 7 interviews on different platforms, so I'm very grateful for that.
Yeah, that's awesome. Yeah, I have a podcast too, if you guys want to check it out, called Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health, where I have all kinds of conversations like this one with TJ, who's been a guest a couple times. And yeah, just exploring these frontiers of like what else is possible with healing, recovery, consciousness. What are the infinite possibilities? Thanks again, TJ.
Thank you, Adriana. Thank you, everyone.
Okay.